My name's David Pencheon from the University of Exeter in the UK. And my reason for talking
Hang on,
with you
David,
now
we're just going to get
is
oh,
really
you're
to
not
share
talking.
my experience.
Excuse me.
on
We
10
are going to get a
years
little bit of volume
working
from up the
in
back. Can we do that?
UK
It's a
between
little
about
bit quiet.
2007 and 2018 on
Very
coordinating
quiet.
activity,
One more.
changing legislation,
Okay, good.
changing regulations, coordinating social movements around a sustainable health and care system. So I'm just going to tell you a few stories about how we did that, some of the many mistakes we made, some of the things I would do if I could do it again, and hopefully help other communities, countries, states sort of accelerate their journey towards the inevitable need to be low carbon and biodiverse and sustainable as soon as humanly possible. So I just thought I'd start with this diagram about health and where we fit in. You all hopefully know that health and care system largely has a beneficial effect on health, not always, but usually. And climate change has a very bad effect on health. And climate change also has a very bad effect on the health and care system. It's very difficult, very much more difficult running a health and care system with floods, with heat waves, and other globalized issues like pandemics. But I've also got to remember that the health and care system has an adverse effect on climate change. We in the health and care system are part of the problem, not universally part of the solution. And it's that part of the equation I really want to concentrate on, what our roles are as health professionals and as health systems and health organizations. So what does it take to change a system? It takes people. There are lots of technologies, lots of techniques, lots of ways, lots of methods. It's a people-based, changing a system like a healthcare system is a people-based, and it's very, very important to remember that. I suspect that none of you in Christchurch or Wellington or Auckland or online will need to be reminded of that. So we started, when we started this journey in the health system in England, this was the strapline, high quality care for all. And one of the things that happened during our time is we managed to get it changed. Now, the addition of those 5 words, now and for future generations, may not seem a lot, but actually in England, what it did is it sort of legitimized 1.3 million staff to take the future seriously. And actually, the future is not something that healthcare systems take seriously. We're largely crisis junkies. We're largely peak creatures of now. We love blue lights, we love emergencies, we love drama. To do planning for what's going to happen next week or next year or next decade or next century is not something really part of our normal way of operating. But we actually, you know, it's clear everybody has a responsibility to make sure that they don't do things in a way today that messes up adversely the chances of future generations who obviously have no voice and choice at the moment. Simon Stevens, the chief executive for much of the time while I was working in the NHS, has made this very important case. And it's a very obvious case, really, that we should never get the urgent, such as COVID, confused with the important, such as climate change, the ecological collapse. But again, having Simon Stevens saying that meant that it made it part of the day job. It's not something a few greenies would do on the side. This is a core part of healthcare business, and that's very important to remember. And last year, you may know that we've gone even further now to pledging, way before our national targets, a net zero national health service in this country. So, in a sense, let's go through some of the learning points on this journey so far, and we're only 10 years into it. The first is that we need to establish entry points to engage our colleagues, and a very important entry point is not what's going to happen to the climate in 30 years necessarily, but it might be what happens to the budget now. So to save money, to comply with regulations, law and scrutiny, and to set an ethically and socially responsible example. Those, in summary, are 3 of the most important ways of engaging your colleagues, your chief execs, your finance directors. You don't want to break the bank, you don't want to break the law, and you do not want to break your promise and duty to those you purport to serve. There are other entry points, obviously, to acknowledge and address the scientific evidence. and to meet the expectations of others. So staff engagement is very, very important. Leaders often don't lead until they see the pressure from below. And then there are the entry points for engaging other people, and trust is a very important part of that. I mean, a lot of us who work in a health and care system don't really understand what it's like to be trusted. We fail to remember that we are hugely trusted, often dangerously so. And the evidence of that, this comes from the Ipsos Mori survey that's done in this country every year. This is 2017 data, but it hasn't changed in the last couple of years. These are the 5 most trusted professions in 2017. Every single one of them works in the healthcare system: nurses, doctors, teachers, professors, scientists. The healthcare system is very, very replete with these professionals. So by doing nothing, we are doing harm. By saying nothing, we are complicit with us sleepwalking into a nightmare. The second thing we can do in the healthcare service is we can demonstrate the future happening now. One of the great things about the healthcare systems is they're so big in any country that you'll nearly always catch someone doing something right in a way that makes the future make sense. So here's an example. This is just one example of many. I mean, we could be here all day with examples. This is a large hospital in northwest England. You can tell it's a hospital because it has a chimney and a big car park. A new hospital was needed. This and here indeed is the new hospital. So that's the new hospital built. It's smaller, smarter, cleaner, greener, cheaper to run, much more pleasant to be in, and much more efficient and much more future-proof. So there's a lot of good reasons. But perhaps what's really interesting is what happened to the old hospital, and that's what happened to the old hospital. Most of it was knocked down to make great green space. And believe me, I've been to that hospital a number of times. It's a lovely building to be in. Very few hospitals are lovely places to be in. Very few hospitals are health promoting environments. If you're not ill when you go into hospitals, you often are ill when you come out. That's a very nice example of being able to do. Now, this is not a place where people accumulate. It's not an illness factory. It's a real community hub, actually. It's a children's hospital, actually. Many children are treated in this hospital, not in the hospital, but it coordinates the treatment and the preventive healthcare, very important preventive healthcare, that we deliver in the community. See, waste and pollution is just another wonderful entry point to engage people. And if any of you are under any illusion as to how much waste we produce in the healthcare system, this is 101 single-use pieces of plastic generated by one typical tonsillectomy operation. This is by a paper by Chantal Rouzan in the Journal of the Royal Society of Medicine last year. And it is eye-watering. None of you need reminding that this is eye-watering sort of stuff, that if we keep doing this, if we act like there's no tomorrow, there will be no tomorrow. And we will end up living on a planet like this. Air pollution is another form of climate change mitigation, adaptation. It's very important to remember that climate change per se is not a great entry point when you're trying to engage people, but air pollution is. And especially when you look at the data, because you'll see that addressing air pollution delivers a lot of co-benefits, i.e. immediate benefits now in terms of improved air quality, but also reduction in greenhouse gases and health-related climate harm in the future. So this is London, and we have about 40,000 early deaths across the UK per year attributable to air pollution. That compares with about 3 early deaths attributable to water pollution. Why we tolerate this is an absolute mystery. It's a scandal. I mean, how we do this is beyond us. And London is not the worst city in the world by any means. Translate that to other metrics, and that's an average of 8-month loss of life for every person in London. And clearly, when you do it for New Zealand, it's over 1,000 early deaths and nearly 1,000 hospitalizations, which are avoidable every year. And New Zealand is a small, smart, clean country, so this still happens. The fourth point I would say is the role of health systems, health organizations to be anchor organizations. What are anchor organizations? It's like a university, like the University of Otago. It's like a sports center. It's like a health system. It's like a local government. They're here for good. They're local and they're big. Now you combine the power of these local big anchor organizations in ways that make them sustainable ethical procurers, good employers, and visibly exemplar organizations, good partners with each other. Now, in that sense, a healthcare system, by just pursuing those four things, can improve the health and equality in a local population as much, almost as much as you might imagine direct healthcare can. So healthcare systems can be health promoting even before they deliver healthcare. And that's one area, one of many, where they have a profound role in terms of safeguarding the future. Here's an example. This is a hospital in Nottingham in the East Midlands of England. So a colleague of mine there, John, he completely revolutionized the food system, making sure there was local supply chains with fresh food, organic food, which was seasonal and much liked by patients and increasingly in staff as well, and actually the local public who came into the canteen. This John absolutely changed the food system, the purchasing system. Previous to John being at this hospital, food was cooked, chilled, wrapped in plastic, and trucked through the nights from another country into this hospital. About as climate unfriendly as you could possibly imagine. So using the buying power of your healthcare system, your hospital, your health center is very, very important. This is from Johns Hopkins. This is Ted Howard's Democracy Collaborative, where Johns Hopkins have committed to, in Baltimore, into employing local people, people of color, small organizations, SMEs, in order to improve the life chances and health of local people over and above the direct healthcare they deliver. This is from Northern Ireland. This is setting a visible example to show that renewable energy is part of the health mix. It's a commercially viable thing. It saves money, saves a lot of money, and it continues to do so. And it generates carbon-free electricity, not only for the hospital, but to sell on the open market, where the profits go directly back into healthcare. If none of those entry points actually suit the person you're trying to engage, fairness and justice is another issue which some people quite rightly are indignant and concerned and angry about. This is a map from the Lancet report in 2009. This is over 10 years old now, showing countries in the world proportionate to their emissions, their greenhouse gas emissions, and no surprise there that the industrialized countries are large in that respect. And this is who is suffering and dying most. So if you just compare those two slides, these are the producers of greenhouse gases, these are the people who survived. This is WHO data on climate change mortality. I don't think anybody can look at that and say that's acceptable. This is unjust, it's unfair, and it's happening on our watch, and about which we have a responsibility to do something about. Here's another example about social justice. A lot of us buy fair trade coffee, fair trade tea, fair trade cotton, but I don't know how many of us buy fair trade surgical instruments. So Abu works, he's 7 years old, works in Silicot in Pakistan. He's paid £25 a month to make surgical instruments in conditions like this, and not all the factories in Silicot are like that, but half the surgical instruments in the world start their journey in similar conditions. Abu is quite likely to lose an eye or a finger before he's grown up, and this guy, Mahmoud, my colleague Mahmoud Bouta, is an ENT surgeon, has done a lot to promote fair trade, medical and ethical supply chains around the world. And even if you just do this one thing, you'll be doing a great thing as a health professional if you just join up with people like Mahmoud and look at what happens in New Zealand about where your surgical instruments come from. And sixthly, is having better conversations. This is probably one of the most important things we've worked on over the past 10 years, is helping people listen to their colleagues, listen to yourself, listen to your patients, and in a sense, frame the case for health professionals and health systems having a duty of care to take the future seriously. We cannot say, because we are doing good in terms of healthcare, we can ignore all the other ways we can do good or do harm. And one of the ways we can do this is to build, this is just one example, is the last line on this slide, which is to build sustainability and the ecological crisis into one of the dimensions of our quality of care. So, you know, don't underestimate any possibility of engaging people with any, and humor like this is not trivializing it. Humor is a very deep-seated emotional engagement technique. And in terms of quality in healthcare, this is a paper from the Royal College of Physicians in London by Steve Atkinson, showing that it's perfectly acceptable to put in sustainability as one of the dimensions of quality. So taking our climate responsibilities in the healthcare service is not something to be left to a few greenies on a wet Wednesday afternoon. It should be hardwired into the governance of how we deliver healthcare, alongside all those other dimensions of quality, such as effectiveness and safety. And finally, I think it's really, really important to remember that, and one of the reasons why people like yourselves listening today need to come together and make the case for your healthcare system in New Zealand to take this seriously, is to start defining what it means, measuring it, and reporting it openly, consistently, regularly, and ambitiously. And that requires you hardwiring it. So if the hospital in Auckland, the main hospital, the acute hospital where I used to work many years ago, needs to step up and say, this is tricky, this is difficult, the metrics aren't mature, but we will start this journey by trying to measure our waste, our water, our energy, our procurement chains, how much we spend in the local economy, our greenhouse gas emissions, our particulate matter. So one of the things we've done over the past 10 years is try and collaboratively develop metrics where we can allow people who want to report, who are keen to be first movers, to do it consistently and comparatively and increasingly ambitiously. And alongside accountability and governance is getting the state, the country to start expecting it and eventually mandating this sort of activity by all healthcare organizations. And finally, using the law to make change. I know that there's a lot of health reform going on in New Zealand at the moment. And this is really important. While healthcare reforms are being made, this is exactly the time to embed deeply into the governance of the healthcare system our duty to future generations, not just our duty to current generations. And don't forget, you can use the law to make change, but you can also make the changes that you make voluntarily by innovators to make the laws. Here's an example. I don't think we have time to go into it now, but we've tracked multiple times the scopes 1, 2, and 3 greenhouse gas footprint of the healthcare system in this country. And many countries have done this around the world now: Japan, Australia, United States, so Scandinavian countries. So this is not an oddball practice. This is becoming part of our expected obligations. And you find out where it comes from. You find out what interventions are effective to both improve health directly now, but to improve health for future generations. So a lot of these laws probably won't mean much to any of you, but there will be similar laws in New Zealand about civil contingencies, climate change, public services. Wales has a very interesting law about the well-being of future generations. And of course, we're all signatories to the UN Sustainable Development Goals, which can be used as a mandate, as a framework, as a well-negotiated, largely evidence-based framework of metrics on which to assess progress of anybody's health and care system around planet, people, prosperity, peace, and partnership. and I hope you're very familiar with those 17 goals. So in summary, what it takes to change the system is to convene and listen, is to join up with people. You know, one person is a crank, 2 people is a pressure group, 3 people is public opinion. You need to hunt in packs with unusual partners. So engage people by listening, educate, share real facts, share real data, share real stories. Stop knowingly harming the people and planet today for the sake of today when we realize it's going to have even greater harm tomorrow. Spread what's already working. There are lots of things. Be brave enough just to plagiarize and copy and adapt and improve what other people are doing. Don't feel proud. And shout about it. Shout about your mistakes and your successes as well as your failures. And make sure that what you do is visible, and make sure you know that your partners and your patients know you're trying very hard. You may not be as successful as you like to be, but you need to give other people confidence by showing them that it's possible to make progress. Make action allowable. Let people do these sorts of things. Make it part of our day. Put it in job descriptions. Have sustainability offices within hospitals. Have a unit and have a sustainable development unit in New Zealand. It's very difficult to see how progress can be made at the pace we need to make it if we cannot join up and through a coordinating unit like an SDU. It will not happen accidentally. It will not happen randomly. It will not happen through a collection of well-meaning people acting in an uncoordinated way. Seed control, disseminate the leadership, empower people to act. Just encourage people to act, ask for forgiveness, not for permission. Don't wait around to be told. Stimulate, support, and join social movements. Social movements are incredibly important in enfranchising those people who feel powerless and lost and lonely and angry in this journey. We need to, as you've seen from some of the stories, you need to reframe it in a way that aligns with other people's values. If people don't share your values, don't worry about it. They will have other values which you can align with. We're not all the same. We don't all have the same values. Follow the money. Just be ruthless about money. Economics dictates far too much in this world, and before, until we can change it, we've got to be realistic about the money and show that the money is saved. Show that other resources are saved. It's not just that economics is not just about money, it's about other sorts of resources, intellectual capital, human capital, natural capital, social capital. And make it fun too. I mean, this is not don't make it doom-mongering. Plenty of stand-up comedians can earn a lot of money talking about health and climate change. Believe me, you have to excite people. You have to make it part of people's, mission. You have to make it meaningful and purposeful for people. Quite a lot of people in the climate change world saying, I do this for nobody but myself. I do it for myself because I find it fulfilling, I find it important, I find it meaningful. It gives me purpose in my professional career and my personal life. Make it normal. Just expect people to do it. Don't give prizes or awards to people who do outstanding things just turn around and say, why aren't we all doing this? And measure it. Very important to evaluate. Get your university colleagues evaluating and holding a mirror up to yourself and others. Make it unacceptable and shameful. Ultimately, you've got to embarrass people. People aren't going to always do this journey willingly. And finally, you need to use the law, either to make it compulsory or to seal the change that has happened. So I hope that's been useful. Act together, hunt in packs, join up, listen, and remember, this year is a year of COP26, both in Glasgow, in the United Kingdom, around climate, and Kunming in Yunnan, China, around biodiversity. Those twin roles of biodiversity protection and climate control are incredibly important. So thank you for listening. I'm very happy to take questions. I'm very happy to learn from what you're doing. And I'm very happy to support anybody who feels that we have anything to offer from our journey in England. Thank you.
Kia ora, David. I'm hoping you're able to hear us here in Wellington in New Zealand, Aotearoa, New Zealand. I'm not sure where you actually are. When you come online, perhaps you could tell us. Be good to know. A lot of alignment between your messages and what we heard from India, actually. Quite interestingly, by doing nothing, we're doing harm. by saying nothing, we are complicit, sounds a little bit like teach us how to riot, you know, which is not a bad thing. There are lots of questions. Where are you, David?
Well, I'm in Dorset on the south coast of England, David.
Oh, how lovely.
Yeah.
Lovely. Thank you for joining us late in your evening. It's very kind.
No, it's great. It's great to be with you.
I loved your talk. Thank you. There's a number of questions here for you. So Victoria is collecting them up on our little Slido app, and she'll read them out to you one by one, and we'll start a little bit of a discussion, if that's okay with you, for about 15 minutes.
Sure, sure.
Cool. Thanks. Go for it.
Kia ora, David. So our first question, the hospital serving healthy food, can you clarify if the food was whole food plant-based?
It wasn't entirely plant-based, although to be fair, there are completely non-meat eating hospitals in the world. Indonesia has plenty of hospitals where no meat is eaten at all, except where there are total parenteral nutrition required. The issue with that hospital was that it was local, it was fresh, it was largely organic, and the supply chains were short. And more important than that, it got local cooking skills back into local populations. And in fact, the food production was so good that, as I said, the public started coming into the hospital canteen. And rather than make it non-allowed, the hospital started making their canteen a community resource, which was a very wise thing to do, so that people stopped fearing hospitals and started seeing them as community hubs.
Thank you. The next question, can the NHS get there with incremental change to the current model, or does the model of care need revolutionary change?
Yeah, this is a really interesting question. One of the things I often say is that efficiency is the enemy of transformation. I mean, clearly efficiency is a good thing to do, but the danger of efficiency is it tends to hardwire the current model, and sometimes you need real disruption. So the danger of just incremental efficiency is it does not give you the opportunity to start again. One of the impressive things about that hospital in northwest England is not that they built a new one, is that they largely demolished the old one. And you have to starting new things. Anybody who's been involved with healthcare policy and strategic innovation, doing new things is relatively easy. Stopping people doing old things is remarkably difficult. So, you know, just beware efficiency, that you shouldn't go back one stage and question, what are we actually trying to do here? So it's a great question. So full marks for the great questions. And sometimes you do need to do efficiency to start the transformational journey, but don't put all your eggs in the efficiency basket. That's not going to work.
Kia ora. Just a reminder for those of you attending via Zoom, can you please put your questions into slido.com #SHCH2021, and then they'll show up and we'll answer the questions. The next question we have for you, David, we're hoping to install an SDU here in New Zealand. Are there resources available that show what specifics of the setup are in the NHS?
Yeah, this is a good question. I mean, it's really good that someone asked the minister the question, because it's a really important question. And I'm clearly biased because I've worked in a unit such as that for 10 years. I mean, one of the things to remember is the unit does not need to be big. I mean, I think we had maximum 6 people working in it. And this is for an organization with staff of 1.3 million people. It does not need to be big. So, and it doesn't do all the work either. What it does do is coordinate and align and link up the work that's been done. I mean, 99% of the work is done in the field, but having a unit gives huge confidence to people who are trying to behave sustainably under the radar. It gives huge confidence for them to say, I am doing this because it is part of our national health system's approach to better health. I mean, one of the biggest mistakes we've made as environmental campaigners is to treat climate change as an environmental issue rather than directly a health issue. As soon as we start framing this as a health issue, it gives us much more license and mandate as health professionals to talk about it. We shouldn't be second-rate climate scientists. We should be first-rate health professionals and treat it as a health issue, as a health threat, and indeed as a health opportunity, as David said. But a unit, I think a unit is very, very important. It doesn't need to be big. It can support the field and also hold other leaders in the health service to account. It should not gather all the activities to itself, otherwise it'll swamp itself. And more importantly, people will say sustainability is not my business because that little unit over there does it. Now that's a complete disaster. Where I would take issue with the minister is it's all very well to say you're going to integrate sustainability throughout the system, but you need to be clear that when something is everybody's business, it nearly always ends up being nobody's business. That's really, really important. So there is a huge advantage of having a small, nimble, dedicated, empowering unit like an SDU. And in fact, the cost is negligible. In fact, the cost for us was negative because we saved more money for the health system than it cost to run the unit. So, you know, if you're into cost-benefit analyses in a political sense, that's not necessarily a difficult argument to win.
Kia ora. The largest proportion of emissions comes from Scope 3 emissions. How do you propose the health system pressures industry to make sustainable changes?
Well, interestingly, the industry doesn't need that much pressure because the industry is far more innovative than any health services. What the health service needs to do is to be prepared to buy goods and services where sustainability is a core part of the offer. And in our experience in England, the best way to do that is to put it into contracts. Writing contracts is the most unglamorous thing you'll ever do in your life, but it's a very powerful lever. It's a very powerful tool to, again, legitimize companies, industry, to provide products and services to the healthcare system, which are sustainable. In fact, plenty of companies would be delighted to do it. And, you know, we had these conversations a lot with industry. They'd be delighted to do it if the health service put that in the bid. If it said, rather than a single-use plastic item, we would like we would like to buy maybe plastic items that lasted 20 times before they had to be disposed of. The industry would jump, industry would innovate, but because we never asked, because we never specified, because we never put it in the contract, the assumption was that all we would go for is the cheapest. And that's not always the case. The cheapest is not always the least sustainable. So it's not a very glamorous answer, but contract writing and negotiating with suppliers in a competitive world is a very important part of that Scope 3 journey.
And our last question from Slido, where should the accountability stop if climate goals are not met? What form should that accountability take?
Yeah, well, all accountability starts with yourself. I mean, the person to hold, the place to hold accountability starts with yourself. What do you do? What do you do as a clinician, as a nurse, as a doctor, as a manager, as a chief exec? Then what do you do as a board, as a team, as a ward? Then what you do as a hospital or a region. Where does it stop? Well, sadly, accountability is in very early days at the moment, but it's not so much where it stops as to how it's embedded in the system. And clearly the most important, if you read any report, any annual report, accountability report of a hospital, it will go very big on the financial accountability. And then it'll go a little bit on clinical accountability in terms of avoidable deaths, what have you. What it doesn't have is the full suite of accountability that actually a lot of businesses do, which is around full financial, environmental, and social reporting. So one of the things you can do, if you have a board to your hospital, which says, what can we do? Well, you can start the journey on triple bottom line accounting. And even though a lot of your fields, a lot of your measurements, a lot of your data will be empty or not available, just by putting them there and saying, we hope to report on this metric by next year or in 3 years gives a sure sign that it's a journey, that you are fulfilling an aspiration, an obligation, an ambition to do these things. So triple bottom line accounting is tremendously important to move away just from financial accounting.